When a loved one is at home or in the hospital and suddenly is not acting like themselves, it can be confusing and even scary. Hi there, I am Courteney Munch, Advanced Practice Nurse, Geriatrics.
And I am Nadine Sebahana, Nurse Specialist, Geriatrics.
In this video, we're going to talk about delirium, what it is, what causes it, and how you can recognize the signs. We'll also go over how delirium is different from dementia, what you can do to support a loved one experiencing delirium, and how to work with the medical team to help them recover.
Delirium is more common than many people realize, but the good news is that it can be prevented or managed with the right care and support. Delirium is a sudden and serious change in the way a person thinks, behaves, or interacts compared to their usual self. It can make someone feel confused, disoriented, very drowsy, or act differently than usual. A person with delirium may have trouble recognizing where they are, who is around them, and what time it is. Delirium is considered a medical emergency, so if you think a loved one is having delirium, contact a doctor or go to the nearest emergency department.
Did you know that delirium affects up to half of older adults while they're in the hospital and can often go unrecognized? However, delirium can be prevented or treated, and with the right care, many people get better over time. Delirium is often mistaken for dementia, but they are different conditions. Dementia is a long-term condition that develops over months or years, causing damage to brain cells. It affects things like memory, thinking, language, and daily functioning. Delirium, on the other hand, happens suddenly, within hours or days. It can come and go, changing throughout the day or from one day to another. A person may seem like their usual self one moment, and then suddenly appear confused or not themselves the next. People living with dementia are at a higher risk of getting delirium, so recognizing the signs early can help them get the right care.
Recognizing delirium early is important because it can come in suddenly and may not always be obvious. Here are some key symptoms that might indicate someone is experiencing delirium. People might feel very confused or unsure about what's happening around them. It may be hard to focus or pay attention to things. Some people see or hear things that are not really there. These are called hallucinations. Others may strongly believe something has happened to them when it has not. These are called delusions. Delirium can also affect sleep and mood, causing drowsiness during the day or restlessness. Some people experience sudden changes in emotions, getting upset or angry for no clear reason. If you or someone you know is experiencing these symptoms, it is important to seek medical help right away.
So, you might ask, what can cause someone to experience delirium? There is not just one cause. It is often triggered by a combination of factors. Even something as simple as being in a new place like a hospital can lead to confusion. Other common causes include illnesses such as an infection or having severe pain. Certain medications, especially if someone is taking multiple prescriptions. The sudden stopping of prescribed or non-prescribed drugs and regular alcohol use. Injuries from falls, like hitting your head or breaking a hip. Lack of sleep makes it harder to think clearly. Changes in the body, such as dehydration or low oxygen levels. Understanding these causes can help us recognize delirium early and take steps to manage it.
If you're a family member, friend, or care partner and you suspect a loved one is experiencing symptoms of delirium, providing support can make a huge difference. Here are some ways you can help. Talk to them gently. If they seem confused, answer their questions with kindness and try not to argue. Tell them where they are and who is with them. Patience is key. Familiar items can bring comfort. A favorite blanket, a photo, or a stuffed animal can help them feel more comfortable. Remember to bring essentials like glasses, hearing aids, or dentures. These small items can make a big difference. Encouraging good sleep is important. Try to keep them active and stimulated during the day so they can rest better at night. If they're having trouble sleeping, talk to their doctor or nurse. Hydration is key. Make sure they are drinking enough fluids, and if you notice they are not, let the nurses know. Most importantly, be patient. Delirium can cause a person to say things that don't make sense or behave in ways that seem out of character. Your patience and reassurance can help them feel safe and supported as they recover.
One of the most important ways you can help is by working closely with the medical team. If you notice a sudden change in your loved one's thinking and behavior, don't hesitate to speak up. You know them best. They might need extra attention, special tests, or an adjustment to their medication to help with delirium. Your voice matters, so be sure to share what you see with their care team. Delirium usually improves once the causes are found and treated, but it can be hard to know how long it will take for a person to feel better. Some people start feeling better in a few days, while for others, it may take weeks or even months. In some cases, a person may not fully return to the way they were before the delirium. Every recovery is different, and patience is key.
Remember, delirium is not the person's fault. It is a common problem, but with the right care and support, many people do get better. Nurses, doctors, families, friends, and care partners all have a part in helping the person recover from delirium and feel more like themselves.
Your support, patience, and willingness to speak up can make all the difference on their road to recovery. Whether you're a patient, family member, or a care partner, you're not alone. The care team is here to support you every step of the way. Together, we can make sure everyone gets the care they need to feel better.
We hope this video will help you recognize the signs of delirium and support someone experiencing it. If you would like to learn more about delirium, we have included additional resources in the description below. Thanks for watching, take care, and remember, we're here to help.